We can consider a person has tested positive and he has undergone the medical procedure what he needs to follow, and now he is completely recovered. So what are the measures that one should take post COVID?
Post-COVID, if he
Yes.
has had a lung involvement and the lung involvement was significant as seen by a CT scan done on the 9th, 10th day, not before. You don't need to do it before. People come to me, sir, I've got a CT, I was tested positive, I was having some congestion, I got a CT scan done. I said, your score must be less than 5. Yes, sir, it was 4. Big deal. You get a score done after 10 days. What is your score now? Sir, 15. That is something. Not on the first day. Do it later. Do it later when you have real problem. And if you have a score which is bad, more than 10, so CT scan score, there are 2 CT scans score. Sir, my CT score is 20. I get, oh my God, you can't be talking like this if your CT score is. What is the CT score they're talking about? They're talking about the RT-PCR CT score. That CT score is a cycle threshold score. I'm talking about the COVID radiological score, CORAD score of CT scan. That is different. So that comes as 0 to 25. 0 to 10 is mild disease. 10 to 19 is moderate disease. 19 to 25 is severe disease. The cycle threshold has no meaning. Just ignore it. Sir, my cycle, there's a long write-up after this, the RT-PCR report. You would, those of us who have got the report, they'll see that. Long write-up. Heavy viral load, if the CT score is between 10 and 20 or less than 10, it is very heavy viral load. Depend on several variables. How the sample was collected from outside the nose or deep inside, from deep throat or from somewhere here, and whether it was kept nicely, preserved nicely, tested on the same day, tested after 3 days. So many variables are there. So earlier it was thought to be an index of viral load. And what is cycle threshold? If there are very few viruses, you multiply the number of viruses by 1 cycle. Again, you test it because you need to have a minimum number of viruses for the test to be positive. So that many cycles, if you have done 35 cycles, then use more than 35 cycles, then it is tested as negative, reported as negative, because there are no viruses even after 35 cycle of amplification, then there are no viruses. That is RT-PCR. Not at all important for decision making. The CORAD score tells you there is significant damage, 10 plus moderate damage to the lung. You need to do breathing exercises. You can go home and do proning, lying on your tummy, and breathing exercise. Simplest exercise, they'll tell you to buy that little, spirometer. Don't go into that. Tell your people to buy balloons and blow balloons. Every 2-3 hours, blow balloons. Perfect. Best technique. You don't need a spirometer. You don't waste money. It probably costs 1,500. It must be costing more now. Just buy 10 rupee balloon. It will last you more than a week. Nothing more is required. Or these days you don't get the old style football bladders from the sports store. Get one of those bladders and keep it, and you don't need to buy balloons also. How much can you inflate with one blowout? Best. So with breathing exercises, deep breathing exercise can be done without breathing balloons also. Blowing balloons, other one. Blowing football bladders, next one. And when you're lying in bed, you can lie on your tummy.
Those were the easy methods, sir.